Health IQ Podcast, Dan C. Trigg, your local healthcare hub. Learn about the wide range of services offered at your local hospital.
One of our largest economic assets is our local hospital, but many people are not aware of all the services and how to access them. Today, we are happy to have our hospital administrator, Vicki Gutierrez, here to share about the hospital. Our crew today is Bobby Hockaday and Joyce Runyon, and I am Brenda Bishop. Before we get started today, I do want to disclose that I am a board member for Dan C. Trigg Memorial Hospital. In this role, I learn each time that we meet about some new service that's available, and I'm just so impressed with all the things that we have at our hospital, and I am proud that Quay County has been able to maintain this hospital, even as our county sort of shrinks, but I'm proud of that. So Vicki, thank you for joining us for this episode. I know you've been at the hospital for many years. I think you started as a floor nurse even and have worked your way all the way up to manager and or administrator, not manager. You were nurse manager.
I was. Yes.
But administrator. And you also were raised here in Quay County, so you were really familiar with our county and our needs and our people. And I think that's wonderful that we actually have an administrator who's familiar with us. So several months ago, I was at the hospital getting my yearly mammogram, which I think is a great service as well. And I talked to several people in the waiting room, and one was telling me that Health Council really needed to be promoting some of the services because they didn't know until their friend used swing bed that was available, and they were so excited about that. And another man was there waiting to get an infusion, and he was telling me about how excited he was about not having to travel for an infusion. So that got me to thinking we really needed to do a podcast here about all the great things that we have to offer. But I thought we should start with the basics, what our hospital does and offers. And our hospital's owned by the county, which is a little unique, and leased Presbyterian, who runs the hospital. And there's some big advantages to being associated with a bigger hospital. So I thought we might even start with some of those.
Absolutely. And thank you for having me. I appreciate the opportunity to reach out to our community and let them know what our services are. I believe you're correct. A lot of our community members don't understand everything we offer, so I think this is great. A little history about Dr. Dan C. Trigg Memorial Hospital. The building itself was built in 1965. Presbyterian took over and started leasing and managing operations in 1978. So they have been there for a long, long time. Yes. I've not been there that long. I have been an employee of Presbyterian and Trigg Hospital since 1998. So I have been around for a while. I was born and raised in Tucumcari, as you mentioned. But one of the advantages of our hospital being a part of Presbyterian healthcare systems, it gives us access to up-to-date technology, the most up-to-date equipment. We have an integrated electronic health record that patients, whether they're being seen in the clinic or the ER or as an outpatient for a service, we can get in that chart and see everything that's been done. So that's a huge advantage. And then also access to specialty services. If we don't offer the service here in Tucumcari, we can hook you up within some other specialist, maybe in Clovis, possibly in Albuquerque. But it gives us a network of individuals and specialty care that we can get our community members to. And that's something that if we weren't with Presbyterian, we might not would have access to.
Well, and there's also some probably knowledge advantages as far as staying in compliance with the ever-changing rules around healthcare or laws, I guess.
Yeah, absolutely.
Keeping up with all the different insurance changes.
Yes, and so we get a lot of support from the Presbyterian system, the corporate level, as we call it, for multiple things, such as that, keeping up with regulatory requirements, making sure we remain in compliance. But we also get advantages, purchasing power. We're able to purchase supplies at a decreased rate than what we would be able to if we weren't with Presbyterian. which then is a cost savings to not just the hospital, but to our patients. We also have other shared resources, to help us recruit. It's difficult to bring people into small rural areas, doctors, nurses, even techs, other
Right.
physicians in our facility. And so the power of Presbyterian and that support and resources really assist us in keeping the hospital operating.
Well, and I know during COVID, many small hospitals across the nation had to close because of all the high costs associated with getting supplies and staffing and all that. But we were not having to close because we had the support of Presbyterian.
Yes. So unfortunately, there has been some closures of facilities, as you mentioned, throughout the United States. Healthcare was hit very hard by the COVID pandemic. That's another thing that was great about being partnered with Presbyterian. They were able to support us. They kept our employees whole. They kept the hospital running. All the services were available. And then we were able to do additional things for the community. We did vaccination clinics. We did COVID infusions. So really helped us ease through the pandemic and keep the care here in Tucumcari. So it was
That's
great.
Wonderful. So one thing we hear about during different times of the year is the gross receipts tax that Quay County passed in order to be able to maintain a hospital. Can you tell us a little bit about that and how that benefits the hospital?
Yes, ma'am. So Quay County does support the hospital through actually 3 different ordinances that are related to taxes. 2 of those are evergreen. They were voted in many, many years ago. But the one you mentioned is a gross receipts tax. We have to put it out to the voters every 5 years and get it approved. The result of those is about $1 million that comes to the hospital on a yearly basis. That $1 million goes into everything from basic operations, maintenance of the building, or to even salaries of our staff. So it's hugely important to us, and we appreciate the support from the community.
Yes. And without that, it'd be much harder to keep our hospital going.
Absolutely.
So I know everybody's familiar with the fact we have an emergency room, but they may not be familiar with some of the unique things about our emergency room. And one of them that you mentioned was that we are one of the only ones on this area that's staffed by physicians.
Correct. So a lot of smaller rural facilities are staffing their emergency rooms with nurse practitioners. We love our nurse practitioners, but we have the only ER between Amarillo and Albuquerque that is staffed by a physician 24/7. And they are emergency trained physicians. They are on site the entire time. They stay in the hospital. So that makes us somewhat unique. And the advantage of that is really that care. We can care for anything that walks in the door, whether it's an urgent care type of a matter or a major trauma out on the interstate. We have the resources, we have the medications, we have the equipment, and we have that provider, the physician, that's able to do any of those things that we need to do. So somewhat unique for a small community.
Well, and so necessary with us having 2 major highways running right through the here.
Yes, we get a lot more trauma victims off of the interstate and just travelers stopping through that are very, very sick. Probably more so than people realize that come into our ER for care.
And the other unique thing I did not realize until I became a board member was that these physicians are assigned to our hospital, and they're the same ones here for quite a while. And it's not like we get a new one every week.
Correct. So yes, our physicians are contracted. We use a group called Schumacher, but they do designate 6 to 8 physicians to us so that we know who's going to come. We're familiar with them. They are familiar with us. And it really helps to provide continuity of care for the patients and for the staff. So they're familiar. They know each other's capabilities, and it's really great.
Several years ago, my family had to visit the emergency room several times in the course of a year, and we were fortunate enough to have the same physician every time. So, he really became familiar with our our history and needs. And stuff.
Yes,
So
and that's one of the
that was very
advantages
cool.
that the doctors learn the community members, and they invest their time and getting to know the people. So I think it's great.
So I know there's another sort of mistruth that's out there because we do have a helicopter stationed at our hospital that serves other hospitals. So, but people see it flying out and they're assuming that every patient is flown to somewhere. Can you talk about how many patients that come into emergency room are actually transferred out?
Sure. And you're right, there is a misconception about the helicopter. So we lease our helipad to a helicopter, but that helicopter is not dedicated to Trigg Hospital only. So if there's a major car accident, they may be responding out on scene to that. They can respond to other area hospitals such as Santa Rosa, Clayton, Clovis, and take patients for them as well. So I know there's a perception that if the helicopter's lifting off, there's a patient in there, but it's not always true. On average, we transfer 10 to 11% of our emergency department patients, which is about 40 to 45 individuals a month that have to be transferred out to what we call higher level of care for trauma or for ICU or some kind of specialty service that isn't offered at the hospital. But it's a very minimal number compared to what most individuals think.
Right. And so as we talk about that higher level of care, I know there is even some misconceptions about emergency rooms should be able to offer everything. And really, because of equipment and stuff, we probably couldn't offer everything. All right.
So everything is a very broad term.
Right.
We are, as I said a little while ago, we are able to care for anything that walks in the door. But we are never going to have a cardiologist here that can do a heart catheter. That's just never going to happen in Tucumcari, New Mexico. So if you're having a heart attack, please come to the ER. We stabilize you. We can give you medications. But yes, you're ultimately going to have to be transferred to a different facility that can perform that heart catheterization. And that's just one example. But we absolutely have the equipment, the medication, the knowledge, the skills to be able to treat whatever walks in our door.
Right. Just not always the specialists.
Not the specialist.
You have
may
to
not
go to
get
next.
Right. So if you come in with a fractured leg, we can set it, we can splint you, but we can't perform that surgery.
Right.
Gonna have to go somewhere else for the actual surgery.
So I think that's an important point to get across to people, though, that, not everybody is sitting out, only those that have to go to those specialists or special care. So the other thing is we do have patients that sometimes stay in the hospital, even though a lot of people only think of the hospital as an emergency room. We do have patients who stay there. Can you talk a little bit about inpatient care at the hospital?
We do, yes. So we are able to provide care on an inpatient basis. Some people may be more familiar with the term acute care. What that means is somebody that needs to be admitted into the hospital, say 2 or 3 days. Maybe they just need their blood pressure under control. They need antibiotics because they have pneumonia. So we are able to do what we call general medical care. So we don't have an ICU. So if you are severely sick, you are going to go to a larger facility. But if you have a basic pneumonia, your COPD is acting up, you're having problems, congestive heart failure, we're definitely able to keep those patients. Additionally, we do the swing bed, which we'll talk about in a minute. We do swing bed patients. We also do respite care for hospice patients. So if the family that's taking care of a loved one just needs a break, 4 or 5 day break, we bring those into the facility and take care of those individuals as well.
Wow, I did not know that.
Yes, ma'am.
See, I'm learning a new service. So you did mention swing bed. So why don't you go ahead and talk about what swing bed is? I think this is so cool.
So our swing bed program, and the term swing bed is kind of a funny one, but you literally take that acute care or inpatient bed and you swing it basically to a rehabilitation type of a bed. So we're able to do that in the same room, utilize the same staff. Those individuals typically come in after they've had some kind of a health scare, maybe a fractured hip or a fractured leg, and they need some intensive physical or occupational therapy. They can come to us for a couple weeks. We can get them up and moving, get them back to their prior functioning level, and then they're able to transition home more successfully. So,
Well, and this would take the place of having, if you were had your surgery in another community, they would put you in a skilled nursing facility for a short rehab, and your family would have to travel back and forth to see you.
Yes.
Here, you can have that same thing without
Same
have
care.
to travel.
Yes, same care. Your family can come visit. They can even bring your little puppy dog to visit you, and it's more like receiving care at home versus being away and that hardship for yourself and your family.
So if you wanted to take advantage of swing bed, how does a person go about doing that?
So there are some requirements. You have to have been in an acute care facility for 3 days. That's one of the regulations. There has to be a doctor order referral to us. We'll review the chart, we'll look at it, make sure we can give you the appropriate care, provide everything you need, and then get an authorization depending on what your insurance is. And then we just bring you over, and we work closely more so with the El Morello hospitals because it's easier for us to get transportation. We work closely with those hospitals, and they will send the patients back to us so that they can get the care back in the community.
That's wonderful. So then I mentioned infusion centers, and you mentioned infusions during COVID. So I assumed when I first heard of infusion center, it was during COVID time, that was all you offered. So I was really surprised when one of my family members started needing monthly infusions that it was available here, and that's been such a lifesaver for us. Can you talk about what kinds of infusions you have?
Sure. So we've done infusions for quite some time, but we haven't really put it out there publicly and shared that. We're really trying to grow that. So during COVID, it gave us that bump. We did the COVID specific infusions. And what that allowed us to do is get all those processes in place and learn everything we needed to learn. And so now we're able to offer outpatient infusions. Everything from treatment of autoimmune disorders, chronic diseases. We can do blood transfusions. We can do electrolyte therapies, IV iron, basic antibiotic infusions, albumin, just tons of things that we can do. We've actually created binders and shared with all the independent clinics here in town so that they know if they have a patient that's having to go out of town for something like this, they can send them to the hospital.
Oh, it's such a time saver and, of course, money saver, not having to travel.
Oh, absolutely.
So that's been a real blessing for us. And the process is just basically to get your physician to order it?
Yes.
Here.
So we need a physician order. They can work with my individuals in the business office. They will assist the doctor to get everything to us that we need. They'll get the prior authorization if one's required from insurance, and then they will get you scheduled.
Oh, that's so cool.
Yeah.
So the other day when we were talking about doing this podcast, you mentioned something I also didn't remember, that you also do bone density tests.
We do. So that is part of our radiology department. And I think most individuals, when you think of radiology, you think of a basic x-ray for a wrist or an arm. But our radiology department has multiple, we call them modalities. So bone density is one of them. Mammography, you mentioned earlier, you can come get your annual mammograms. We do that. We do fluoroscopy exams. We have CAT scans. We have ultrasound. And we do have a mobile MRI truck that comes one time a week.
Oh, wonderful. And those are the same kind of process. You can just tell your physician, even if they're out of town, that you could get this service here and you will forward those results.
Yes. So we can do those exams with any doctor's order, whether that's a local doctor, local nurse practitioner, or a specialist out of town. All we need is that order to be able to complete the exam.
So another thing I notice a lot is, as a board member, is we approve a lot of radiologists because I guess there's a high demand for radiologists, and we actually use companies that we send our things to be read by different radiologists?
We do. So yes, radiology is one of those very in-demand positions and very hard to recruit. So Presbyterian has contracted with Radiology Associates out of Albuquerque, and they read all of the radiology exams for all of Presbyterian. So it's a digital process. Once your exam is done here, it's sent to Albuquerque, and that radiologist that's sitting in his office behind his monitor reads those exams for us and then sends the results back to us.
So, it's not just the tech reading it. It's somebody who's really skilled at reading these and getting those results to us. So that's a good thing. So we've talked about, lab. And that's another service my family uses at least once a year, for our yearly labs. And so thankful that we can get those labs here if we're having surgery and they require labs. We often can do that here and save time as well. So
yes, so our laboratory partner is Tricor Reference Laboratory, and they're also around the state, but they're located in our hospital, and they can do, just like you said, they can do all the outpatient items. If you're needing to follow up with a specialist and you need lab work done before then, they can save you a trip out of town by doing it here, and they can fax those results to your specialist. Or prior to surgery, they can do all of the pre-op laboratories here. They really offer a great service, and they perform therapeutic phlebotomies at our lab, which is when somebody has a blood disorder and they're making too much blood. They have to come in maybe once a month and get blood drained off.
Wow.
It's almost like donating blood, but for that individual, it's a life-saving therapy, and our lab does that as well.
Wow, I did not know that. See, another new service. So, of course, one of the things that the hospital expanded, I don't remember how many years ago, but into primary care with the Presbyterian Medical Group. But that's still, there's several Presbyterian Medical Group clinics around the state. So
there is. So Presbyterian does offer primary care throughout the state. For us here local, we have our PMG clinic that's located right there at the end of the hospital. We staff that with one physician and 2 nurse practitioners. They actually just expanded their hours, trying to help the community have access. So they're opening at 7 a.m. and going till 5:30 p.m. Monday through Friday. Yeah. So greatly expanded hours. And then we actually have the Logan Medical Clinic as well. They're not doing the expanded hours because they only have 1 nurse practitioner, but they are open currently Monday through Friday as well.
And I know that several people have been really pleased with the services there. And they have access to then some telemed.
They do. They have access to some telemed support. They too can get specialty support from other providers. And they offer care from birth all the way up to the end of life. They're able to care for every individual that comes to them.
That's wonderful. So another service that my family has taken a lot of advantage of is physical therapy. And I've been so pleased with physical therapy. I feel that it really helps a lot of things, but the not having to travel an hour and a half to get to it has been pretty nice too.
It does. And so our we either call it rehab service or physical therapy. Those services include physical therapy, occupational therapy, and speech therapy, which we were able to add the speech therapy about a year ago, and it's been a godsend. They can work with people that have sports injury, people that have degenerative diseases, generalized weakness, people that might be needing surgery but trying to strengthen up before they go to surgery, and of course, after surgery. So they really do a lot. Those same individuals actually go out into the homes and work with our home health team and go out into people's homes and do some of that same care there as well.
Wonderful. And another service I think you still have is pulmonary services.
We do. And pulmonary services, so those are services provided by our respiratory therapist team. They have several different types of services. One of them is a pulmonary rehab program. That's for people that have chronic lung issues, whether that's COPD or maybe they went through COVID and they're continuing to have lung issues. they can come into that program and my respiratory therapist works with them, strengthens them up. They do exercises and just learn how to participate while having lung issues. We've had some great success with that. And then they also offer outpatient services like EKGs prior to surgeries. They do pulmonary function tests, and they actually do home sleep studies.
Oh, wow. That's right. I did hear somebody tell me that they went to the hospital for a sleep study.
So it's
connected with them.
Yeah, so it's a home sleep study. The respiratory therapist connects you to a device. They send you home to sleep overnight. It monitors you, and then they bring it back in and they take it off and ship it off to the company for evaluation.
Oh, so many things. So one service that you've mentioned a couple times, my family has not yet taken advantage of, is home health care and hospice care. And I know we do have daffodil days to raise money for that, but other than that, I really don't know much about what's offered.
So Tucumcari Home Health, they provide services to patients in their home. Sometimes it's medication management after a surgery, after a hospitalization, chronic care. They do a lot with diabetic patients. They do a lot of wound care, but they actually go into the home and work with the patient and the family. A lot of education, how to care for yourself and how that family can assist. It's really a great thing. It keeps people out of maybe skilled nursing homes, gives them the opportunity to be independent at home, but still be able to get that care that they need. So it's a great benefit, and we cover a lot of area. They go all the way to House, Logan, Mosquero, Naravisa, towards Santa Rosa. They cover a lot of distance, that team does.
I'm thinking, what else? Volunteer opportunities. I know that there's at least one volunteer opportunity at the hospital. Are there more?
There's actually a couple. One of the volunteer opportunities didn't really finish on home health and hospice. So hospice is the other thing that my home health team does, which is providing that end-of-life care and keeping the patient comfortable, helping the family in that transition and learning to grieve and just assisting them with that. It's a very, of course, hard time in people's lives, but my team can help the patient be comfortable and help the family with that transition. There is an opportunity to volunteer with hospice. As you mentioned, they do daffodil days. I think it's in March or April every year. They raise money to be able to support that team and the hospice people. We have a social worker, we have a chaplain, as well as our nurses and our aides. And they are a dedicated team and really love to go out into the people's homes and take care of them. But there is a volunteer opportunity there. Individuals could come and help do some office work, help with the daffodil days, or they can go into the homes if they're comfortable and maybe just sit with that patient while the family needs to go to the store. So lots of volunteer opportunities on the hospice side.
And then on the hospital side, you have your auxiliary ladies?
Yes, our auxiliary ladies, commonly known as the pink ladies, although they're wearing turquoise now, they are our biggest volunteer group. They're the ones that you see when you first come into the lobby. They always have a smiling face, and they're sitting there to help direct and give you information. They are always looking for volunteers to help out. Phenomenal group of ladies, and they actually do a fundraiser as well towards the end of the year called Season's Greetings. And they utilize that to help the hospital with things that we might not be able to have otherwise. So they've done everything from buying ice machines to putting up new blinds in patient rooms. They just refinished our chapel for us, reupholstered everything, painted the walls. They're just a phenomenal group, and they want to give back. So
yes, and they help you figure out how to run that kiosk.
They do. They do.
Let's see, what else are there other services that we've missed? I think we have talked about a lot of services.
We have. I don't believe we missed anything. I did want to touch on, I know we have a lot of individuals that are concerned about insurance and how to sign up or get assistance on what they can qualify for, like for Be Well New Mexico and Turquoise services. So we actually have a certified financial advocate that is stationed in our business office. Individuals can set up an appointment with her. She will sit down and help that individual evaluate what the best options are. The individual has to choose it. She cannot choose it for them, but she will assist them in that entire process. And she's been trained to do that. So she knows what the options are and how to guide the individual and get them signed up. So,
Well, and that leads me to something that I know that Presbyterian all across the state offers, and that's some charity care.
yeah, so we do offer charity care. We actually give back to the community about $1,000 a month, 1.2 million on average per year. And that can include those individuals that aren't able to pay their bills, or people that maybe they have insurance, but they can't pay those copays. And so it ends up being a write-off or charity care for the hospital. And that's our way to give back to the community and make sure people are getting that care. So it's actually a large amount of money. We actually, going back to the gross receipts tax of $1 million, we actually provide more than that in charity care to the community.
I see those numbers every month. I'm going, wow.
Yeah.
So we did not mention some services that are provided by others, like SANE.
Yeah, so if we partner with a group out of Clovis, they're a RISE SANE, which is Sexual Assault Nurse Examiners. Sounds very daunting, but if an individual has been assaulted and needs support immediately or even long term, we work with that group and of course the police departments, and we are able to offer those exams and that support in the hospital, so that again that individual doesn't have to be going out of town to try to get those services, especially during a crisis.
That's wonderful. So we're about out of time, but we like to end our podcast with some food for thought. And the one we picked is, I think it's very appropriate, especially learning all the things we've learned today. Hospitals are the heart of a community, keeping it alive and well. So if we don't have a hospital, our actual death rates, our age will decrease. Our death age, is that what it's called? The
Life expectancy.
Yes, life expectancy. I'm like, what is that?
Yes.
Would actually decline in our community, which it already is lower in many rural communities. So
it is, and we are very rural and even considered frontier, according to the state of New Mexico. So having a facility with all of these service, it's huge for our community.
Yes.
And we do not want to be one of those communities that lose that hospital, because it would be detrimental, I think, to a lot of our community members. So
yes. So thank you for joining us today. This has been so eye-opening, even from you, who has learned a lot in the last couple of years about the hospital. And we appreciate that. Oh, we have a gift for you.
thank you.
For participating on our podcast. It's one of our Health IQ mugs. And we'd like to thank all of you for joining us today. And please come back next time, as we will have another interesting health topic.
Special thanks to our guest contributor for this episode, Vicki Gutierrez, Dan C Trigg Memorial Hospital, Hospital Chief Executive, Hospital Chief Nurse Executive. Our host for this episode was Brenda Bishop, Quay County Health Council Coordinator. Cool thanks to Gordon Runyon, our locations manager, for keeping us chill. Health IQ podcast crew. Our director was Robert F. Hockaday. Our producers are Robert F. Hockaday and Joyce Runyon. Our camera operator, Robert F. Hockaday. Our second camera assistant, Joyce Runyon. This episode was edited by Robert F. Hockaday. Credit music was provided by David Morris. Funding for Health IQ provided by a New Mexico Better Together grant. Brought to you by the Quay County Health Council. Follow us on YouTube, Facebook, and Instagram at Quay County Health. If you have any content ideas, reach out to us by email, healthhiqpodcast@gmail.com. More info about this topic and more available on our Health IQ blog, QCHEALTHCO, UNCIL.org.
This podcast was created solely for educational and entertainment purposes. It is not intended as a substitute for advice from a healthcare or mental health professional.